Iron deficiency can cause hair loss in men and women. Now, there are many more reasons for hair loss, but iron deficiency is an important one because it's seen relatively frequently, especially in women, in vegetarians, and people with gastrointestinal bleedings, or if they have a low vitamin C intake. In vegetarians, the food is of course more vegetarian, more vegetables, and vegetables contain something called non-heme iron, and the bioavailability and the uptake of that is less as compared to animal products. With women, iron deficiency can be seen due to periods. The loss of blood can cause iron deficiency, and it's also seen in pregnancies because the need for iron increases, and if it's not matched with either supplements or iron in the food, it can cause iron deficiency. It's seen with patients that are deficient in vitamin C. Vitamin C is important for the uptake of iron in the GI tract, and deficiency in vitamin C can cause you to take in less iron. There can also be other situations, just like with pregnancy. The need can increase, say if you have started an exercise program and it's not matched with an increase in the iron intake. It can also cause iron deficiency simply because your need for iron has increased and your dietary intake is at the same level. Now, iron deficiency has been connected to a number of hair conditions, for instance, telogen effluvium, female pattern baldness, male pattern baldness, also called androgenetic alopecia, is also seen in the alopecia areata. It can also cause whitening of hair, premature whitening of hair. So if you have whitening at an early age, you may want to consider what the iron level is. The recommended blood test for iron deficiency is ferritin. And you may see that the lab value is often like for women around 10 to 12 to 15 nanograms per milliliter, and for men around 20 or above. But I actually recommend that you are much higher than this, preferably more than 50, if possible even more than 70 nanograms per milliliter for you to have healthy hair. Now, iron is super important for a long range of situations, apart from the fact that it can also cause anemia. So you don't look at hair health only, and you shouldn't be just looking at reaching the normal values according to the lab. You should be well within the normal range. So 50 minimum, 50 nanograms per milliliter minimum, and preferably 70 nanograms per milliliter or above. Obviously not beyond the toxic level. The toxic range starts much later, so 70 is not even close to be too high, even though you may think so if you look at the lower range of iron. If you're suffering from iron deficiency, it can cause hair loss. If you're suffering from hair loss, it can be due to iron deficiency. It can also be due to a number of other reasons. It can be your thyroid, it can be lack of sleep, it can be you're stressed, physical stress, mental stress. It can also be due to acute illness. And keep in mind, in cases of acute illness, the ferritin level may be higher than it actually is. Ferritin normally reflects the storage of iron, but in case of acute illness, as a response from the body, the ferritin level may increase, and once you're out of that illness, you'll have the true value of what your iron stores are through the ferritin. You can also measure serum ferritin, but normally I would say serum iron levels, but normally it's fully sufficient just to look at the ferritin levels to make sure that you have sufficient amount of ferritin. So, if you have any questions about hair loss, please do speak to us. You can find the email and our contact information down below. I hope you like the video. Click the notification bell, like the video, share it with your friends and family, subscribe to our channel so that you're updated with new videos if you click the notification bell. If you want us to speak on a certain subject, let us know. We'll look into it and we may make a video on that subject. We offer live consultations in Pakistan, Norway, Denmark and UK. You can also book an online consultation if you're not able to attend any of our clinics. Thank you for watching.